If you've already had pelvic floor physical therapy and you didn't get the results you were looking for, that can feel really frustrating. I was talking to someone the other day, not a patient of mine. We were having lunch at a diner, and she happened to share with me, probably because of what I do, that she had some urinary incontinence. And I did ask her, have you considered pelvic floor physical therapy? And she said, oh, yes, I've done it twice. The first time I went, and it was mostly just about doing Kegel exercises, and that didn't work all that well. And then later I was sent again, and this time the therapist decided that my pelvic floor was too tight. So she mostly did manual therapy. And honestly, I didn't really agree with that and didn't feel like it was helping me, so I didn't even finish. And then I talked to my OBGYN, and she suggested we do some urethral bulking, and that didn't really work either. So now I just use pads, and sometimes I use a pessary. And I said to her, that's really frustrating. It's really hard when you aren't successful. People tend to blame themselves when it doesn't work out. And especially because you got two different messages about what the problem was, it's just really hard to know what to do. And she said, no, I'm okay with it. But she started to tear up. And I said, oh, I'm sorry. I didn't mean to talk about this here. I mean, we were in the middle of a diner. And she said, no, it's okay. I just didn't realize how much shame I had associated with it. I thought I was doing okay. And we only talked about it briefly because that just wasn't the setting for that kind of conversation. But it's common for people to blame themselves when things don't go well, especially if you've taken the risk of going to pelvic floor physical therapy. I mean, that feels really vulnerable, going in and talking about those problems with a stranger, and then it doesn't work. I mean, that person tried 2 courses of pelvic floor physical therapy and a medical procedure and still hadn't gotten good results. So it's easy to start to blame yourself. I've heard people say, oh, I've tried pelvic floor physical therapy and it just didn't work for me. And when you try something and it's not successful, it's easy to come to the conclusion that you're the problem. But that's not necessarily true. Pelvic floor physical therapy not working is not necessarily evidence that you are unfixable. There could be other reasons why it didn't work for you. And many of those reasons are not anything that you did. For example, your assessment might have been incomplete. Now, pelvic floor physical therapy is a specialty within a specialty, and not all therapists have the same amount of training or experience. If you weren't assessed for the whole person, then your plan of care might have been missing something. Now, I'm not blaming anyone. I'm just stating the reality of our field. Training varies widely. And you might just not have had a good match between the treatment that you're receiving and the problem that you're having. Assigning Kegels for tight pelvic floor muscles may not be helpful and could make things worse. And yet, trying relaxation practices when the body needs strengthening or support or neurological connections may not be helpful either. And my friend at the diner had 2 different therapists tell her 2 different things. So it's hard to know what to do next. And it could have just been that the system was working against her. Insurance-based practices work under real limitations. Shorter appointments, longer gaps between visits, limited number of visits approved. Some treatments are approved and other treatments aren't. A therapist doing the best they can within those guidelines still might not be able to meet all the patient's needs. And that's not the patient's fault, but it does affect outcomes. I had a patient call me this week. She had waited 2.5 months to get an evaluation at another clinic. And once she went to the evaluation that day, it was going to be another 7 weeks before she could get a follow-up visit or treatment. That kind of gap makes progress difficult. And pelvic floor physical therapy is just not always a quick fix. Some conditions need time and consistency, and a relationship with a provider that understands your history so that they can help you fashion strategies that you can use to help manage your symptoms. Good pelvic floor therapy should feel empowering and give you tools and understanding. It should not feel mysterious. And you might not have been given enough information to participate in your care or give feedback. Pelvic floor physical therapy should feel collaborative. This is what I found. This is what resonates with me. I don't understand this part. Let me help you explain. Figuring out what's working together. And if something doesn't make sense to you, they should be able to explain their clinical reasoning. Because coming to pelvic floor physical therapy takes courage. To take the risk to go to pelvic floor physical therapy and not get results, and then go back and not get results, and then go through a medical procedure, that is someone who is trying to do everything right. And the shame that follows that is real and heavy and not deserved. If you're still here, then you haven't given up. Be proud of yourself for that. And if you think it might be worth it to try again, be selective about who you see and be ready to advocate for yourself. And that's not easy when we're talking about this kind of stuff. You need someone that listens and does a thorough intake and an exam. Someone that can tell you what they found and what their clinical reasoning is. Someone that explains it in a way that makes sense to you, that can provide timely appointments, that makes you feel like a patient and not just a number. I've put together a resource on how to find the right pelvic health PT. It has questions and things that you might consider, and I'll put a link in the description for it. You deserve some clear answers. If you're not sure why pelvic floor therapy didn't work for you, or some of the things that I was talking about today kind of resonated, then maybe it's worth another shot. I'm Holly McDonald, pelvic floor physical therapist, and I'll see you next time.